hard for you to determine the original depth and dimensions of the wounds, or would the moisture not have any effect?
Oh, dimensions of the wounds, it has minimal effect. For depth, the problem with doing depth in stab wounds is that unless you have some rigid structure, like bone, people are compressible. And if the knife blade is pushed in, we don't know how far it's pushed in, because you can take a 3-inch blade and push it 4 inches deep because people are compressible. On the other hand, if you have a rib cage to stop it, then that's a more reliable depth. The other problem is if our internal organs are relatively fixed in position, but not completely, particularly things like lungs. Lungs have to move around inside the body, that's their job. Intestines and other things will move around inside the body too. So if I'm leaned forward and I'm stabbed in the front, my lungs are actually farther forward than they would be if I'm laying on my back. So now the apparent depth that's measured when I'm on my back is greater than the actual depth of the wound. So trying to deal with depths in stab wounds, and you'll notice that for the majority of these, there's no depth given. It's a description of what internal organs and structures were injured. And the reason for that is because of that mobility, and because if I say, oh, this wound was 4 inches deep, and we have a knife that's only 3 inches long, then it's easy to say, well, that knife couldn't possibly have done it, when in fact it could have. I have actually seen in my career stab wounds that were almost twice the depth of the knife that was left in them. So I know that knife actually caused that wound. So that's why measuring depths of stab wounds is sometimes helpful, but it has to be used with caution. But as far as the dimensions, the length, again, if we have a nice, cleanly defined stab wound where the blade goes in and straight out as much as possible, that can give us a good idea of the cross-section of the knife, how wide the blade is, how thick the blade is, whether it's got a blunt edge. But for the majority of stab wounds, they don't go in and straight out. They go in and there is some relative motion on the way out. So virtually all stab wounds, even the ones that we call stab wounds and don't say stab incised, have some incised component to them. And so again, those dimensions, those are not absolutes. And the other confounding factor to that is, as we know, skin is stretchy. And we can change the look, the character of a stab wound depending on its orientation relative to the elastic fibers in our body. These are called Langer's lines after a surgeon by the name of Langer. We've all seen people with big, ugly scars from surgery. And mostly this is from trauma surgery. And those are the scars that cut across Langer's lines so the elastic fibers pull them apart. And those are the real ragged, ugly looking wounds. A good surgeon is going to cut along the line so that the elastic fibers just go right back together. And so that will change the look of a stab wound. So all of these things can modify the look of a stab wound, and out of all of that, way down on the list is moisture. So it's really not going to make a difference.
I should have asked this earlier on. You said there's 60 wounds, correct?
Yes.
And that combines both stab and incise wounds, correct?
That is correct.
How many stab and how many incise?
You know, I don't know that I've ever separated them out that way. Because of what we just talked about, is that most stab wounds have an incised component to them, at least a little bit. And many incised wounds have a little bit of a stab component to them. Typically, we lump them under just sharp force injuries. But as far as actually separating them out, because it's not really that critical, You know, there are some that we know are stab wounds, like the ones that hit the large vessels. That's pretty easy. The one that broke off in the lung, we know that's a stab wound. But others that are just going into the muscle, there's going to be a stab component to them, maybe a little bit of an incised component. Others are going to have more incised than stab. So part of that is a stab can turn into an incised wound if it's not accurately placed or if there's motion. So what may be an intentional stabbing motion may simply turn into an incised wound, and vice versa. An incised wound can turn into a stab if the other person isn't where they're supposed to be from that context.
Especially if it's coming in a quick frenzy state.
Certainly.
So during your examination and on direct, you noted yellowing around some of the stab wounds?
Yes, sir.
And yellowing around the skin can indicate reduced blood flow at the time of injury.
Well, it's actually in the fat, but yes.
And when blood flow is significantly reduced, it may suggest that the individual had already been incapacitated or deceased.
Well, it tells you that there's not much blood flow in this area. And if there's not much blood flow, then there's not much blood pressure or there's not much blood. And at some point during the loss of blood, yes, you are going to die. And so those wounds won't have bleeding into them, or they'll have very little bleeding into them.
When the yellowing of the skin does not occur if the blood flow is normal, though, at the time of injury.
Correct. And again, I don't want to be pedantic, but it's the fact that we're talking about.
I didn't go to med school.
I know you.
I'm not a doctor, so I'm just trying to keep up with you. Does the presence of yellowing support some of the wounds were inflicted after significant blood loss?
Absolutely, yes, sir.
You said that the cut to the jugular is a large blood flow, but it would be slow because of blood pressure.
Right.
If the blood flow decreased rapidly, however, that would result in some stab wounds appearing less severe or with less surrounding areas. Did I say that correctly? Does that make sense? Let me rephrase that.
Please.
If the blood flow decreased rapidly, again, not done. If the blood flow decreased rapidly, this would result in some stab wounds appearing less severe, right?
Or having less bleeding into the soft tissue surrounding them. Yes. Again, as blood flow progresses, we're going to see less bleeding into the, I said blood flow, excuse me, blood volume decreases, we'll see less bleeding into the surrounding soft tissue. As to the length of time that takes, it's going to occur in the same order, but the time frame is going to be flexible depending on how quickly the bleeding is taking place. But again, jugular vein bleeding is vein bleeding, not artery bleeding. So it's going to bleed more slowly. And it's actually more amenable to pressure being applied to